Darryl, what are you going to do today? What are you going to teach us today?
So today we're going to be using this something called a Tourniquet from Marmed. This is to help.
Let me get a view of that.
So here's the Tourniquet from Marmed, and this is a finger tourniquet to help out with if you've got a patient with digital injuries that are somewhere that is distal to the actual joint space here, so that you can put this proximally and control blood flow. You can get a better exploration in a bloodless field or a laceration repair, nail bed repairs, any number of injuries that can happen to the hands. That way you get much better control of the field.
Okay.
It's a pretty simple device here, so it's good for one finger, obviously. And here it's got this rubberized outside. You've got two kind of holds here that you can take two hands and stretch it. You see it kind of stretches that membrane in the middle. Or you can take two fingers and stretch it, which is a little bit more difficult once you get in there, but you can still do it.
Okay, so you can do it one-handed?
One-handed or two-handed.
Okay.
And we're going to presume that her third finger here has some sort of distal injury. And you're going to take it and you can slide it over the finger. Now, depending on how much you stretch this membrane, be how much force is actually placed on her finger. So you can let it squeeze a little bit, and if you slide it slowly up the finger, it'll actually remove some of the blood and push it back up the venous system.
Yeah, exsanguinating the finger as you do that.
Yeah.
I mean, that finger actually does look like it's a little bit more pale
compared to the other.
Oh, look at that, yeah. It's definitely more pale compared to the other one. So, now, is that causing you any pain of any kind? No,
Not
no
really.
discomfort, nothing at all?
I mean, it feels weird, but it's fine. It's
yeah.
not painful.
Does it feel like your fingers got any paresthesias or going to sleep or anything like that?
No.
Okay.
So, now that we've got this here, whatever repair or exploration that we're going to do, we can do, and it should be much easier, especially for visualization, given that there's not blood flow that's going to continue to pour in. Now it's time to remove it. You can see that we've got this outer ring that's here in the inner membrane, and you should be able to just cut.
Now, can you just try and stretch it and pull it off? You want to
now you can stretch it and pull it back off.
Yeah, that wasn't too bad. That wasn't too bad.
Yeah, it wouldn't be too bad, but the always concern is, depending on what repairs you've done.
Yeah, you're pulling that right across where you just recently
you don't necessarily want to do that. But so then to remove it, you're gonna pull up if you can and cut into it, and then it'll tear right around.
Oh, nice job. That was slick.
That was very
I get
slick.
excited about little things. So.
Yeah. It came off very nicely. You're not gonna.
And I think the trick is pull it up so that
pull it enough to where you can
it's
have
away
some
from the
visualization.
Yeah.
Of the center hole. So a useful little device.
Model, you did a wonderful job.
Thank you.
We thank you and your fingers. And thank you for helping here videotape. So
No
appreciate
problem.
it. All right. Yeah. So then go ahead and slide that over. The finger's been numbed up, guys. So. Basically, we're going to have to kind of get this nail put back under. There's a fracture in that distal phalanx, but we're going to kind of cut back on the bleeding here by doing the putting this tourniquet on there. So that worked pretty good. Okay. All right. So go ahead and put your hand back down there. Yeah, dab it off. So basically what you're going to do is you're going to just try and get that nail back, pop back underneath there. And the patient says, and I tend to agree with him, that nail will probably eventually come off. But there's the initial blood that was underneath there is gone. So I think...
The middle, right?
Yep.
All right, can you pick up your pinky finger a little bit?
So we're sewing up this finger, but it actually is just doing more bleeding than we like. So we're just going to put a little finger tourniquet on it.
Lift your hand a little bit more.
Lift your hand a little bit more.
Up, up. Lift off the table.
Push your finger through there. There you go. There you go.
All right.
All right, now wipe that off. And voila, no more bleeding.